For an industry battered by the pandemic, recovery is on globally amid increased domestic and international demand along with growing vaccination rates. But for Africa, the lack of access to COVID-19 immunizations will have longer-term economic consequences.
It's principally around vaccination, as we've seen, and it's one of the reasons why several of the panelists, both from within and outside the industry, highlighted the need for vaccine equity, because clearly this pandemic will only truly be overcome when vaccines are available worldwide and available to everybody who needs one. And it's the reason that we've been saying that at IATA, we can't have a situation where people cannot travel unless they're vaccinated, but then they can't access vaccines. So vaccination is the issue that will cause the African market's recovery to lag behind.
A point emphasized in this panel discussion with industry experts.
We've been in this for 18 months.
Yeah.
This is not, we can't manage by exception anymore. This has to be managed as a continuous threat. The infrastructure behind vaccines has to be built. Vaccine equity has to be considered as part of this, because you're going to close off the developing world if we're not careful.
A September survey conducted by IATA showed that air travelers are increasingly frustrated with the COVID-19 travel restrictions, with some 67% of respondents expressing a view that country borders should be open now, up 12 percentage points from a similar survey conducted in June.
We don't actually need to encourage people to fly. People want to fly. And we've seen strong evidence of that. The reason that demand, when we report on it, is significantly down is people can't fly. And they can't fly because we have restrictions that are impeding international travel. Once those restrictions are removed, and you saw that in charts that were shown over the last day, there is an immediate response in bookings from people. So actually, we're not in an environment where we have to start taking measures to encourage.
While arguing that COVID-19 test requirements before international travel are now proving more an impediment to the recovery than a health concern, urging flexibility in permitting the use of cost-effective antigen tests as an alternative to the more expensive PCR.
Our position is influenced by the WHO, who have said, if these testings are required for health reasons, then the cost should be borne by the government. Ideally, we'd like these tests to be removed. I think there's still a lot of testing that is not required. But there's very clear evidence to us that where tests like PCRs have been mandated in countries, the price associated with those tests is way beyond the cost of providing the test. There's plenty of evidence. We did research 6 months ago, maybe 5-6 months ago, which showed that the price variation across 16 countries went from zero. In France, they were provided free. Then I think in Kuala Lumpur it was $27, and in Tokyo was $270 for the same test.
An industry only expected to turn a profit in 2023, with forecasts for 3 successive years of losses exceeding $200 billion. The urgency for recovery could not be more acute. Shervin Bryce-Pease, SABC News, Boston.